I just wanted to have a chat to you today about tongues. We all have one, well, most of us, and it is a very important part of our body. It has very important functions. So talking, so you're forming letters and sounds, you're moving your tongue about, and you can actually feel it when you're talking. We have our taste buds there, so we can taste the food. If you have problems with your tongue, it has a knock-on effect to a lot of other things. So for example, if you have a dry mouth, your tongue tends to be quite dry. So that can affect your speech because it's, moving a tongue around that's dry. It feels like a roll of carpet in your mouth almost. It's massive. It's not massive, it just feels like it because it's so dry. It is important to clean our tongue. Now you can get toothbrushes that have a tongue cleaner on the back of them. You can actually get a specially designed tongue scraper. Get hold of the tip of your tongue, pull it out as far as you can, take whichever tool you're using and move it from the back of the tongue to the front. Now, when you first start doing it, you'll probably be gagging and all over the place. You will get used to it. So just start doing the very tip and then you can work your way back and you'll be surprised how much comes off. Now, when we look at conditions of the tongue, probably the most common one would be oral thrush. Now, oral thrush is a fungal disease and often caused by taking antibiotics. So you'll see that your tongue's probably a little bit sore, but you have a thick deposit on there, which again you can get off. If it's too sore to use a tongue scraper, there are specific mouthwashes that you can get. Again, a lot of them over the counter. Some of them your dentist or your doctor might have to prescribe, but there are ways around it. There are more slightly rarer conditions of the tongue. There's one called geographic tongue. So when you look at the tongue, it looks like a map of the world. And the reason for this is the cells that are sloughing off, some are lost too soon and some stay on too long. So you've got very, very new surface of the tongue and you've got older, so they look completely different. So that's why they look a little bit like the surface of a map. It can be sore, so again, just be careful with citrus fruits, spicy chilies, that kind of thing, because it can be sore. It's the same with a condition called lichen planus. That is white marks in the mouth. Tends to be more visible on the cheeks, but you can get it anywhere in your mouth. Now, that would need to be diagnosed by your dentist. There is a really, really small risk that lichen planus can lead to oral cancer. However, I will reiterate, it's a very, very small percentage. However, your dentist may want to refer you to an oral surgeon just to have it looked at and maybe biopsied if there's any concerns at all.